I think Morgan just showed up one day as on my new patient list. I immediately kind of recognized her as being a very unique case because she had an aggressive cancer, but in addition to that aggressive cancer, she was carrying a baby.
To this day, I still remember the day Brent Ward called me and called us in the Department of OBGYN to say, we need some help, we need to figure this out. We have a patient who is 14 weeks pregnant with a significant tongue cancer, and we need to collaborate.
When we treat a patient with oral cancer, if possible, we'd like to work in teams where we both have one team removing the cancer, we have another team working on the reconstruction. And when we can work simultaneously, it makes the whole process more efficient. When somebody loses a portion of their tongue, we always go through a bit of calculus, trying to decide what will give them the most function back in their tongue. And tongue obviously is very critical for a variety of things: oral hygiene, speech, swallowing. For most patients, the most common operation we use to replace significant portions of the tongue is a portion of the forearm. It's a delicate operation, however. It's one that requires removal of not just some skin and some fascia from the forearm, but also an artery and some veins that will both give blood supply and drain that blood supply so that the flap remains viable and so it remains flexible and we preserve her function.
One of the interesting things is I had been to meetings even as recently as a year before where people were talking about the treatment of patients with pregnancy and cancer. And generally what was done was either delaying the treatment of the patients or aborting the child to allow them to get full course treatment. And so that was kind of standard what was going on. And when we decided to do this, I think it was the unique setting of University of Michigan, of having those people. I really think the fact that we came together as a team, offered that surgical treatment, but also what we call adjuvant therapy is the radiation and chemotherapy, that all played into the reality that Morgan's alive today and is still going on as a mom to that baby, but also to her other children.
It was devastating to hear that we only had two options, that we could either do treatment and not have this baby or not do treatment, and then we weren't sure if either of us would make it through to the end. And before we had to make that decision, the team at U of M came back to us and said, there's something else that we can do for you. We knew that that was what we were going to do and that that was the only option for our family. My life is very different than it was before. I eat differently, I speak differently, I move my body differently than I did before. And there are days when I get frustrated by that, but it's a really quick, easy reminder that I'm here and I'm happy to be here. I have the best case scenario of a recovery that you can have, and so I'm very thankful for that.